So existing controls, this is the topic we are going to discuss. So now we have some existing controls and we need to know, do we need to improve something? Do we need to add more controls? So if there is an incident happened or near miss, what is the reason behind that? What is the root cause behind that? Is there something we missed? Do we need to use better hard hats? Do we need to use hard hats with lights fitted to them? A different type of gloves? Do we need to use or wear different type of clothes? Do we need to update or upgrade our tools, machines, equipment? Do we need to change our policy? We update the policy. So we needed that in the past couple of years. With COVID-19, we needed to use masks, social distance. We need to stay at home for quite some time. So policy said you don't go to work until further notice, or you cannot go to the shopping center in specific times, and so on. So or up to 15 or 5 kilometers from your home in some areas. So we had lots and lots of policies implemented in our organization, implemented across the state, implemented everywhere. So we had administrative controls. If someone infected with the virus, we isolate them. We check everyone going in or out from our state or our country. So we had to update administrative controls. We had to use engineering controls, like when you go to the airport, they check your health, they check your temperature, they check, they use PCR, other controls there, mechanical controls, administrative controls like signs say social distance, keep 1.5 meters away from next customer in the queue or within the shopping center, wear mask, all these signs saying wash your hand, sanitize your hand, this is the sanitizing station, and so forth. So all these admin controls added and updated in our policies. So we need to review that. We need to make sure the policies and procedures, they are effective. Otherwise, if there is a hazard, it could really affect people, environment, property, and everything. So Woody asking a question, later we can discuss that, Woody. So it is not related to this unit. So anyway, okay, no problem. So we need to evaluate the controls, and we have a checklist. So let's see the checklist one by one. So first one, do the existing risk controls represent good practice? So we monitor, we study different incidents, we investigate what happened, what was the root cause, why we had this incident. Not to blame others, just to prevent the incident, the hazard, the risk from reoccurring. So do they minimize exposure to the risks? So today, the temperature, weather temperature is 35 degrees. Okay, if I'm using sunscreen or sun protection. This will, yeah, help, but I still could be dehydrated. So I implemented one risk control here, but I need to implement other risk controls. I need to drink lots of water. I need to wear long sleeve, wear big hat, don't go to or outside of air-conditioned areas. Okay, so we need to know, are workers aware of them? So workers, they know about the risk controls, they follow the risk control, they adhere and obey the rules and regulations, they wear the PPEs, they follow the checklist or not? Do we have systems or procedures in place? So I need to sanitize my hand. Are there any sanitizers around? I need to wash my hand for 20 seconds. So we need to make sure we have the facility to do so. Masks, are they wearing masks or not? Training provided and supervision also relevant to the controls, adequate or not? I cannot just let you go inside class, play with switches, routers, other equipments without telling you what you need to do and what you can't do. Also supervise you. If you need to wear some PPEs, yes, you will do that. And most important thing, if you are replacing RAM or upgrading hard drive or something, we need to disconnect the equipment if the manual saying so or the safety worksheets saying so. So maintenance, we need to service our car every 10,000 kilometers. So this is well reduce risks. How easy are the controls to work with? So servicing your car. Some of you knows how to service the car. Some of you, we don't know. So we take it to someone trustworthy. So we can do it ourselves or bring a third party. So it's really important to think about that. Yeah, it depends on the kind of the car and also your skills. So, or time. I might know how to do it, but I don't have time to do it. So I need to outsource that. Yeah, self-serving a Tesla. Yeah, it's a bit hard to self-service a Tesla, yeah, and it's harder to get the Tesla at the first place. Yes. Just a moment. So is that clear? So we need to evaluate the controls in place. From this evaluation, monitoring, assessing, studying, and investigating incidents, we can have a plan for improvements, and the improvements will never stop. Planning never stops. Then we implement, we plan first, we implement, we monitor, we improve, then we plan to implement the improvements and so on. So it is a cycle. Okay, just a moment, please. Good. So we discussed the part related to evaluation for the current controls, and this requires monitoring, assessment. Then, as I said, we will improve. So we will review risk controls in place. Then we come up with new ideas or new technologies, new needs. We always discuss with workers, supervisors, team leaders, management, WHS team, different entities involved in the WHS. We call them stakeholders. So we can get ideas or new technologies to be implemented, updating, upgrading, and so forth. Can you imagine some of the dams on the rivers? They are managed by Windows computers, Windows, they still using Windows XP or even Windows 98. So can you imagine? So this is a big risk if these computers hacked. So this will create a big risk. We need to update, upgrade, and so forth. Yeah, your dentist using XP. Yeah, so someone can really get your records from their machines. So they need to upgrade that and improve that. They need to implement defense in depth protocols. So just communicating with the outer world, it will between the virtual machines, also with XP, when you communicate to transfer the data or the records to Centerlink. This is all between the labs and or different doctors. This could lead also to a leak of information. Anyway, I'm getting that on the chat. I'm just clarifying that to people listening or watching this recording. So yeah, there are some critical places still using Windows XP, which is a big hazard. Okay. So we said that we will monitor and report on that. Sometimes we cannot get rid of the risk at all. So we have hot weather nowadays, so I cannot get rid of this weather. So I need to monitor the risk. I need to reduce the risk. So I'm monitoring my temperature. I'm drinking lots of water. I'm monitoring the inside temperature, what I'm wearing, what I'm eating. So we can have physical checks. We can have different levels of inspections. We can have different teams, they check on different aspects. So we keep people also informed with the outcome of these activities when we monitor different risks and report on that. So we tell people, okay, it's too hot, drink lots of water. There is a danger, fire, bushfire risk, so fire ban. You need to stop your sprinkles, or you need to switch your sprinkles on for your garden, and so forth. Okay, here we have self-quiz. What are 4 questions that can you ask to evaluate existing risk controls and identify gaps between these and the desired quality of controls? Any idea? Anyone can help on that? Questions you can ask. 4 questions to evaluate existing risk controls. Are workers aware of them? Yes, good. Can the risk be avoided entirely? Could be, yeah. Are we following and adhering to policies? Yes. Do we have policies in place? Are we reporting on that? Are we logging that? Logging any incidents, any hazards? Are we monitoring different hazards and risks? Are we studying what happened before? Do we need to improve our controls? Whatever the controls we have, mechanical ones, admin ones. Okay, good. So are we using PPEs? Yes. Yeah. Good. Good. Yes. Thank you. for your input. Yeah, are the controls easily followed? Yes, yes, good one. Are controls easily followed, or we need to improve them? Yes, very good one. Thank you. Any other ideas? I can go back to just self-checking. So physical checks. So can we ask someone? Can we get feedback from someone? Do you remember these questions and checklist? Yes. Good, good. Okay. Any questions for me? Any questions? Okay, I'll stop recording.